What is Seroquel and how does it work? Seroquel, or quetiapine, is an antipsychotic medication primarily used to treat psychiatric conditions like bipolar disorder. It functions by modulating the levels of neurotransmitters in the brain, which helps to stabilize mood and reduce psychotic symptoms. The drug's ability to balance serotonin and dopamine makes it effective for managing the manic and depressive episodes associated with bipolar disorder. By acting on these chemical messengers, Seroquel can offer relief from the extreme mood swings that characterize this condition. Although quetiapine is useful in managing symptoms, its precise mechanism of action is not fully understood. Nonetheless, its role in neurochemical modulation is a key factor in its prescription for bipolar patients. While it's often praised for its efficacy, Seroquel's side effects and impact on overall health require consideration. This makes it imperative for patients to have a comprehensive discussion with their healthcare provider before starting treatment. What are the benefits of using Seroquel for bipolar disorder? Users of Seroquel for bipolar disorder often highlight several benefits that improve their quality of life. Here are some of the frequently mentioned advantages. Effectiveness in reducing the frequency and severity of manic episodes, offering greater emotional stability. Potential to alleviate depressive symptoms, which can be particularly challenging to treat in bipolar disorder. Improvement in sleep patterns, aiding in better overall functioning during waking hours. Quieting of racing thoughts, providing a sense of calm and focus. These benefits have been corroborated by clinical trials where Seroquel has been shown to significantly reduce symptoms in both manic and depressive phases of bipolar disorder. What are the common side effects of Seroquel? However, the use of Seroquel is not without side effects. Commonly reported issues include drowsiness, weight gain, and dizziness. Some users also report feelings of sedation and an increase in appetite, which can lead to unwanted weight changes. Less common but more serious side effects may include extrapyramidal symptoms, such as restlessness or tremors, and metabolic changes that could increase the risk of diabetes or high cholesterol. It is critical for patients to monitor for any adverse reactions and communicate with their healthcare provider to adjust the treatment plan as necessary. How effective is Seroquel compared to other medications for bipolar disorder? Seroquel's efficacy is often compared to other medications prescribed for bipolar disorder. While individual responses vary, studies suggest that Seroquel is particularly effective in controlling manic and depressive episodes. Compared to other antipsychotics, Seroquel may have a lower risk of causing extrapyramidal symptoms, making it a preferred choice for some patients. Additionally, its efficacy in improving sleep and reducing anxiety may enhance its desirability. However, it's important to consider each patient's unique situation, as what works for one individual may not be ideal for another. Medical professionals weigh the benefits against potential side effects, making personalized care crucial. What do users say about their experience with Seroquel? Many individuals using Seroquel for bipolar disorder report positive experiences, emphasizing its ability to stabilize mood and reduce the severity of mood swings. Others appreciate its impact on sleep quality, which can be a significant issue for those with bipolar disorder. Nonetheless, there are also users who have encountered challenges with the medication, noting side effects that interfere with their daily lives. It's a reminder that while Seroquel can be life-changing for some, it's not a one-size-fits-all solution. User testimonials can provide valuable insights but should be considered alongside professional medical advice and clinical evidence. What should patients know before starting Seroquel? Patients considering Seroquel should be aware of the potential side effects and the importance of dosage regulation. Starting with a lower dose and gradually increasing as prescribed can help mitigate adverse effects. It's also crucial to understand the importance of adhering to the treatment plan and not discontinuing the medication abruptly, which can lead to withdrawal symptoms or a relapse in symptoms. Open communication with a healthcare provider will ensure the most effective and safest use of Seroquel. Patients should be prepared to discuss their full medical history, as well as any other medications they are taking, to avoid interactions. How does Seroquel affect sleep and mood swings? One of the noteworthy effects of Seroquel is its ability to improve sleep disturbances, a common issue for those with bipolar disorder. By promoting better sleep, it can indirectly contribute to mood stabilization and overall well-being. The medication's sedative properties, though beneficial for sleep, can also lead to daytime drowsiness. Patients often report that this side effect diminishes as their body adjusts to the medication over time. As for mood swings, Seroquel is reported to soften the peaks and troughs of bipolar mood fluctuations, providing a more balanced emotional state. Frequently asked questions about Seroquel for bipolar disorder. Why is quetiapine high risk? Quetiapine is considered high risk due to its potential side effects, such as metabolic syndrome, extrapyramidal symptoms, and sedation. The risk is particularly significant for elderly patients with dementia-related psychosis, for whom it carries an increased risk of mortality. Patients with other health conditions or those taking certain medications may also be at higher risk when using Seroquel, making it vital to evaluate each patient's risk profile. How long does it take for Seroquel to kick in? The onset of effects from Seroquel can vary, but many users begin to notice improvements in sleep and mood stabilization within the first week of treatment. Full therapeutic effects, particularly on mood, may take several weeks to become apparent. Does Seroquel make you emotionally numb? Some individuals report feeling emotionally blunted or numb when taking Seroquel. This can be a result of the medication's impact on neurotransmitter levels, which are central to mood regulation. If this side effect becomes concerning, it is crucial for patients to speak with their healthcare provider to adjust the treatment plan. Who should not use Seroquel? Seroquel may not be suitable for individuals with certain medical conditions, such as diabetes or heart problems. It is also not recommended for elderly patients with dementia-related psychosis due to the increased risk of mortality. It is important for all potential users of Seroquel to have a thorough medical evaluation to determine if the medication is appropriate for them. In conclusion, while Seroquel for bipolar disorder offers numerous benefits in managing this complex condition, it is imperative that the decision to use this medication is made with careful consideration of the potential risks and side effects. User reviews and clinical research form a comprehensive picture that can guide patients and healthcare providers in making informed treatment choices.